Welcome back to season 4 of the How We Can Heal podcast. My name is Lisa Danylchuk, and I'm a psychotherapist specializing in trauma treatment. I created this podcast because I'm surrounded by people who have dedicated their lives to navigating healing. There is so much wisdom in each guest this season, and my hope is that this show makes their important ideas and experiences available to you in a way that uplifts and inspires you. These guests and I have committed our lives to fostering health and joy in the world, even as we work through the impacts of trauma and face deep challenges. Let's dive into season 4 and let's keep talking about how we can heal. Today, our guest is David Archer. David is a psychotherapist, EMDR consultant, and course provider, and offers consultation and training internationally. He's also an advocate of LGBTQ, Black, Indigenous, and oppressed people of color all around the world. His first book, Anti-Racist Psychotherapy, Confronting Systemic Racism and Healing Racial Trauma, explains the philosophy behind anti-racist practice and the mental health consequences of racial trauma. His other books include Black Meditation, 10 Practices for Self-Care, Mindfulness, and Self-Determination, and Racial Trauma Recovery, Healing Our Past Using Rhythm and Processing, and lastly, most recently, Black Mountain Fight for the Future. David and I connected when he presented for the recent ISSTD conference, and I knew right away I wanted to have him on the show. Today, we touch on material from each of his books, and we also share why hip hop is the perfect analogy for trauma therapy, and how gratitude, peace, play, and joy are central to this type of work. If you haven't heard from David before, you're in for a real treat. Let's welcome him to the show. All right, David Archer, I'm so excited to have you here on the How We Can Heal podcast. Saw your relatively recent presentation at the ISSTD conference and was pretty blown away. I was a little bit familiar with your work before that, but just, I think everyone in the audience was like, yes, this person is amazing. So I'm super excited to share you with the audience here and just talk about your work. It's really fascinating and important work. So I'm glad you're here.
Thank you. It's an honor, Lisa. And I'm looking forward to having this discussion with you.
So I always want to know a little more about you and how you got here first. What were some pivotal moments for you in becoming a trauma therapist?
Okay. So I'll try to give you the abridged version, but there's so much that's in there to condense the life of the human. First to just, as we said off mic before. So as you know, I'm a psychotherapist. I'm also a consultant. I do trainings, and I'm also my son is now a year and a month old.
Yeah.
And I feel this is adding another dimension to who I am, is that I'm responsible for developing a human, for teaching a person how to be a human being, to let him know to wave when he sees people, and letting him know not to eat electrical cords, the regular stuff that we take for granted. And I feel that there's no one that exists from a vacuum, and the same with me as well, as that my first career was working as a software engineer and learning how to make complex problems, how to resolve them by using lines of code. And I felt it was very interesting that it's like a person can come up with an idea, and that we can use machines, or we can use technology in order to realize something and make something else happen. So the next step was to go into even more complex systems with humans.
Yes.
So then I started to study psychology. And then in studying with psychology, so I felt a little disappointed sometimes with the way how psychology was taught to me. I felt that many times whenever there would be a mention of someone who looked like me, who was a Black person, it would always be referred to from this deficit perspective. So I'd be taking sensation and perception classes, and they'd talk about the retina in the eye, and then they'd say, by the way, Black people have worse vision than white people. I'm like, why are you guys saying this? Like, why is that relevant to the class? And even when I was younger, studying in because I know in the States, schools are a hot topic of what's taught in schools and all this. So we would read these classics that were literary classics. And it's almost as if they needed to put the N word in these books that are for high schoolers. And I was like, why is it that I feel under attack from my classes?
Yeah.
And so when I got to study social work, it was interesting because I started to also, like, even people outside of the formal education, like some family members, they give me some books that were relating to the history of my people and who I was before the American experiment and the Canadian experiment began, in terms of colonization and the destruction of Indigenous people and the assimilation and all of that thing. And it was interesting for me to know that I came from somewhere other than what the narrative was. The narrative was that my story begins with slavery. So you'd hear things like the first Black person who was a mathematician, the first Black person who did this, the first inventors and all that. When in recovering knowledge of myself and my understanding, it was that some of my ancestors actually were the first people to create the papyrus, so paper, and the first people to create writing instruments to pass on the knowledge in this way. So it became a little convenient that the stereotypes about people like me were that I didn't read or that I didn't study. Yeah. So in high school, not only was it that through the literature, I was feeling, I guess, as if I was not like everyone else in my class. And even through my own studies, I felt as if there was always this deficit model. I felt that I had a responsibility to understand a little bit more about the past of where I came from and to help other people to also clarify where they came from and to recognize that greatness that is within them. So after social work, I did a marriage and family therapy master's. And then I started to understand a bit more deeply about the impact of systems in terms of the relationship we have towards one another, the relationships that even govern our relationship, the social political arena. And because I was already EMDR trained at that moment, it just helped me to have a deeper appreciation for how to fully bring in the idea of identity, the idea of race, gender, how the society sees a person, and to help them to heal from the events that clouded their original understanding of who they were meant to be. So my job, I feel generally, is to help others to heal from the suffering that exists in the world, and also to transmute that suffering so they can use that wisdom to change their lives and those around them. And in meditation the other day, I reflected on it, and I want to add an extra mission objective for myself. It's really to create experiences of gratitude. Yeah. It's like last week, I was using the rhythm and processing approach that I developed. And I developed that approach because I felt there was a gap in terms of, is there a psychotherapeutic approach that is designed specifically to treat racial trauma? I searched far and wide. I made adaptations for it with EMDR therapy, but I felt I needed to develop something from everything that I knew to create something else that was new. And in using this approach, I met with, there was a client I had who was a refugee, and we were able to help to heal her suffering by using gospel music in the session, which was complete, because sometimes what happens is people will believe that their religion, that going to therapy is against the rules of their religion or against the rules of their spirituality. So what happens if we form a psychotherapy that puts their healing modality in the center and makes it so that we can use what they bring to the table in order to help to heal? And so this woman was in tears. She was talking about how grateful she was that she was not only healing from the triggers of their past, but also that she was able to use something that reaffirmed her identity as being a Christian, her identity as being a mother. And I just, in my reflection, in my meditation, it was that I want to not only add those experiences for people that come across myself, I'd like to add more gratitude for myself and to teach other therapists and teach other people, whether professionally or otherwise, to experience that level of gratitude as well.
I mean, I feel like we can just wrap with that. That's pretty.
The microphone is dropped.
Just drop it
end
right
of
there.
the whole session. No, no,
I'm
I'm
really
joking.
impressed. And I have
Thank
so
you.
many thoughts, and I'll try to track them as well as I can 3 months out from having a child. But the first thought is, you
Yes.
meditated and you have a baby that's 1 year old?
Yes.
My
Yes.
meditation this morning was walking and feeling my feet while I was rocking the baby.
But that's beautiful. That's
I
beautiful,
did it for
Lisa.
10 minutes.
And that's beautiful. And I think that even in those moments, like because my meditation was a walking meditation actually as well.
Yeah.
So
Yeah.
and I really think that um uh in meditation, I feel from my own understanding of it, is that we are trying to learn to appreciate the moment that we are presented with.
Yeah.
So it was challenging in the first few months of raising my son. And I was like, I got to wash all these bottles.
Yeah.
What is this? I need to make sure he's drinking these amounts of like milliliters of, I had to do all these measurements and all these things. And it was very different from only being responsible for myself, and even in those I remember even in those early moments of washing things and washing like bottles and his clothes, I needed to reflect on why I was doing this so that I wouldn't personalize his crying and his yelling and his screaming.
Yeah.
I had to realize that he doesn't speak English. He only speaks
Right.
baby. So he's going to yell because this is his way of communicating. And
Yeah.
evolutionarily speaking, it's the most effective way.
Oh, so effective.
Yeah. I mean, it'll wake me up out of my bed. It's like, okay, I got to care for a human. I got to heal this. I got to help this person to feel all right.
Yeah.
And so I needed to reflect on the fact that that it was his way of communicating. It was my responsibility to help him to be able to be at peace and to not to be the best parent, but just to be a good enough parent that can help him to get his needs met. And in reflecting on that, it helped me to realize that indirectly, I was helping to heal the younger version of myself. By being compassionate to him, I can teach him to some degree that it's okay for a man to help another man, or it's okay to hug another man, that physical contact is not dangerous. Because, we live in this hetero patriarchal society that the only time that men always need to keep a little bit of distance from each other, especially in terms of emotional distance. Yeah. So I feel it's almost my chance to kind of like heal like some of the suffering and the programming that I experienced in my own upbringing, and help my son to just ultimately to learn how to love himself and to be okay with himself.
It's an entire reshaping, and it touches upon so many things you mentioned before. I mean, you started with the deficit model, right? And doing something different there. Mm-hmm. You also talked about really large overarching issues, racial trauma, systems in general, patriarchal, homophobic, all these things, right? And so to position yourself in a way in daily interaction with this young human in a way that shifts all of that, and lets some of it go, or reorients, the entire worldview and orientation, not to start with slavery, as you mentioned, but to incorporate all of this rich history globally, or that's, relevant to your ancestors, and to pass that down. It's a whole different frame. And we're responsive to environment. This is something we know, and we learn through experience, and we learn through social work school. If you, just like a single cell organism, you put them in this environment, something happens. You put them in another environment, something else happens. 100%. And so all of that context really matters. And what I so appreciate about your work, and as you describe your journey, is seeing things and going, that doesn't feel right. That doesn't feel right. Yeah. And then the response of, I'm going to play a role in shifting this. Right. And then the next level of gratitude. I really want to live in gratitude. And you described for your son, in peace. Like, what can I do to facilitate peace for this young being who is expressing themselves in a way that goes straight to the core of me and is really painful, but I can regulate myself, and I can come back and find the way to create some peace. And I think it's very similar to what we'll do as a therapist. Someone comes with a loud pain that might be coming out through behavior or through symptoms, quote unquote, or through a diagnosis, and they're coming and saying, help me find peace, right? Help me work through this thing. And so I'm wondering if you can talk about what you have developed a little bit, the rhythm and processing method
Sure.
that, I saw you give some examples of. I do want to let you know there was an example you gave that had a YouTube video with this beautiful bright blue river in it. There was like a young woman doing processing and she was blowing
Yes.
out into the
Yes.
river. And I like flagged that on YouTube. I was like, this is beautiful. And I've used it myself in a moment where I'm like, oh, I got something going on. I'll just visualize. And it's, kind of faded at this point in my mind, but
Yes.
it reminded me of my personal experience in Switzerland where there's these like glacial rivers, right?
Yes.
So I just picture a river like that. And and I've been trained in EMDR. I've done all these things. It's a very simple approach to,
Yeah.
release something that's pent up through your breath. It's very yoga too, right?
Hmm.
But the image and the way you brought it into technology was really fascinating to me. So maybe you can talk a little bit
Sure.
about that for listeners.
Well, first, I want to bring it back to even your work as well, is that I think that to some degree, you may be uh, like as a pioneer in trauma and yogic practices and helping people to heal. I think that, and I don't want to put words in your mouth, but I'm just assuming, is that you probably also saw that there was a gap that people needed a little bit more. And then there was something within you that helped you to craft an understanding and to share that with others. So I also want to commend you for that as well.
Thank you.
Because I remember when I was studying for my MFT and they spoke about trauma, like they spoke about yoga and it being used for trauma. And I was like, I felt at home as an EMDR therapist. I was like, finally, we're talking about the body instead
Yeah.
of keeping everything so like cognitive.
Yes.
And I felt there were some students that were a little bit more apprehensive about it. But I was thinking about how important the body is, specifically when we talk about clients that have complex PTSD. Oftentimes, when we're doing a good assessment, we're going to hear they also have physical complaints.
Yeah.
So it's not a surprise when a client's going to tell you they have fibromyalgia or they have some chronic pain of some kind. And then you look at their trauma history and you see how extensive it is.
Mm.
So I wanted to find out a way in a similar vein of how do I help people to heal the most effective way possible, but also to give them their healing modality in the session.
Yeah.
So when you're talking about the river, there's something that resonates with you, maybe because of the water, maybe because of your love for nature. And what happens if we bring that into the session? What happens if we help the client to know that we can accept all parts of them, including the parts that have experienced trauma, including the parts of them that are resources? And when we do this, it's kind of funny because then people realize that therapy can involve laughing and smiling for no reason. I
Yes,
tell my clients that
100% can.
I tell my clients, if you forget your homework assignment, remember it's just to practice feeling awesome. And usually they're going to practice it because who wouldn't want to feel awesome? So,
Right.
anyways, the development of rhythm and processing came out of a frustration that I had, is that I noticed that some of my clients would get stuck and that I would get stuck and that I wasn't able to help certain clients to stay within their window of tolerance,
Mm.
and that some people would heal and some people would have some more difficulty. So I started to think back to all of the different modalities I was trained in and what were the essential qualities in each of them that seemed to help certain people out of that stuckness. I started first with I had like 5 years experience as an addictions counselor in an Indigenous community. So we learned about motivational interviewing.
Yes.
And there's this one part of motivational interviewing that had to do with this. It's almost like a balance sheet where there's the advantages and disadvantages of maintaining the status quo versus changing it.
Yeah.
And I realized that although I was using it with people who had addictions, there's something about trauma that also resembles an addiction. There's something about the person going or like reverting back to a personality or being attracted to certain types of situations that cause them to suffer to their detriment.
Yes.
And so I brought in a part about motivational interviewing, polyvagal theory. Also, I got to give a shout out to Thomas Zimmerman. He made an adaptation on the flash technique. And in consultation with him, I developed something that I think would work a little bit better with the types of populations I had. And also, what else is that? Well, Black Meditation, my second book, in terms of breathing in the colors and all of that. And I created, I put these things together, and it seems to help my clients to progress and to get unstuck at a reliable rate.
Yeah. And that's what we saw a sample of at ISSTD. And
Yes.
I appreciate things that bring together so much context and intentionality and come across as so simple and accessible, right? Like you said, there are moments in the case study that you shared where there was connection, there was laughter. There was also what I saw was a deep reflection on the part of the client and, internal connection. Like she would take a moment and take a breath and go, oh, there's something still there. And then you would, play the video of the river, and she would, process it and blow out what was still there. And so I think, I saw the EMDR in it, and now I'm getting a little more of context of it as well. And I'm wondering too, you mentioned your second book, Black Meditation.
Yes.
Right, written for. Is that right? I've got them all. I'm not missing one.
Yes.
Well, another one's doing in there.
Yeah, the science fiction novel Black Mountain. This just came out last month. And it's the fourth book. And strangely enough, it's part of the canon, is that it takes the ideas of anti-racist psychotherapy, Black meditation, and racial trauma recovery, and then puts it into the future on a different planet. And it still involves the importance of healing from our suffering in order to the motto. It's like almost like a superhero type of novel where the idea is to defeat the enemy wherever he appears, but starting with the enemy that is located within the self, the part of ourselves that makes us not like ourselves. And of course, it's completely fictional. And it was the hardest book I've written.
Yeah.
Because who knew that it's harder to make something fake real? Right. I was writing and I was trying to, there's people flying in the book and I needed to make it make sense. There's people shooting fire out of their hands and, fighting against technology and all these things. And I had to make it as if it followed, I guess, a logic that is within the book.
Yeah.
And so this book was the hardest one. I think my next book will probably be nonfiction.
Yeah.
But it was a joy to write as well. And in talking about gratitude, it was really that I felt, because the difficult thing about writing about anti-racism is that you need to identify with the suffering to write about it. So for example, if I'm going to write statistics about the suffering that Black people experience, to some degree, I need to identify with it. I have some clients that work with, I have a few clients that are also working with people who have experienced gendered violence. And they talk about a similar thing, is that they would get they'd have some difficulty in finishing their dissertations because they're dissociating while they're writing their assignments, because they're identifying with it.
Yeah.
But that is the reason why I use rhythm and processing with them and help them to be able to find certain types of resources they can access before they sit down to write, while they're writing, and even after they write. But you see, the thing is, I did tell you that I have a son that is a year and a month old, and I lost my train of thought. So you're going to have to help me because I'm slightly sleep deprived. And did that answer your question?
You and me both. We're just going to swim all around the ocean, all around the world.
Fantastic. Fantastic. I'm not alone. I'm not alone. Someone could understand this.
I hope people can follow, because we are both severely sleep deprived and will be for a while, and that's fine. And we can continue to do the work, and we can love and have compassion for ourselves.
Yes.
There is something. So I was thinking about your second book, Black Meditation, and the series of your books and all of the ideas you've put out, the content, the philosophy. It sounds like the adventure of this last book. And I'm wondering, for folks that maybe just are hearing from you for the first time, we've heard about a little bit more about the technique you've offered, but what's different about your approach? How would you describe racial trauma And this is adding too many questions in, but also what's the role of dissociation in that? So maybe you can just start with, how do you describe racial trauma to folks who are like curious about what that is?
Yeah, sure. Well, first, that's a great question. And I promise I will answer this one this time. I will use all of my neurons that are left in my brain to answer this. So
I'll lend whatever I can, but it's not much.
No, it's much appreciated. This is much appreciated. So, first, we need to take a step back and we need to think about the big T traumas and the little t traumas. Mm-hmm. So we know that big T traumas, generally speaking, are going to be objective things that we all agree, or generally we all agree are problematic, mm-hmm. or that would leave a mark on a person. So genocide, sexual violence, generally the society knows these are things that cause harm on an individual. When we go to little t traumas, so these could be a little bit more subjective. Not everyone will agree on the impact of them, but the person who's on the receiving end of them definitely knows that they've caused a problem. So when I do a trauma history, I'm going to look for big T traumas, but I'll also ask, were there ever any times that you felt abandoned or discriminated against? Yes. Any times that there were betrayals at work, or betrayals, loss of friendships, bad breakups, toxic relationships, getting a, the person, because what happens is that a person's nervous system oftentimes is going to respond in this fight, flight, or freeze reaction in a similar way with something that is going to be an objective stressor and also a subjective stressor. So the brain doesn't distinguish between something that is real and perceived. That's the preface. The next level of it is that sometimes when people are sufficiently, or when they're traumatized and it meets a specific threshold, they're going to be diagnosed with something like PTSD. We know there will be these thought intrusions, avoidance of trauma reminders, alterations to the personality structure, hypervigilance. What happens though is that there's some types of trauma that are more likely to impact some people more than others. When I do a trauma history and I have people that identify as LGBTQ, or they identify as being trans women, for example, is they're going to have trauma events that do not happen to cisgendered males, for example. The same thing with gendered violence, violence against women. Oftentimes my male clients do not mention that they had the same exact experiences at the same level. So it means that there's something about our society that is going to cause some people to have different types of traumas than other people. So if a person is going through a sufficient level of stressors due to their identity, then they can have PTSD-like symptoms. When I talk about racial trauma, I'm speaking about how race, for example, is not something that's real. It's constructed, meaning that depending on if you're in Brazil and then you go to the States, you might become Latina or you might become Latino, but you might not have seen yourself in that way. Or you become white if you go to one country versus another. Or for my African clients, they come to this country, to Canada, and then they're Black, but they never saw themselves as Black before. It was more of ethnicity back there. So there's ways how your identity gets constructed because of your social context. And because of your social context, there's almost like this agreement that people will treat you differently and certain types of things are more likely to happen to you. So that relates to the social construction of racial trauma. So in this case, we're talking about anti-Black racism, which is what I made my focus because of my previous education and absence of that type of those types of considerations. What happens is when a person gets when they're chronically traumatized, especially at key developmental moments, these traumas impact a person's nervous system at a deeper level. Also, is that when a person is going to be, for example, Rachel Yehuda and colleagues, they also studied about the effects of the Holocaust. So when people are going through genocidal events, and they meet each other, and then they have children, then their children have children, there's a chance they can pass on a genetic, we can say a vulnerability to mental health issues. There's also that the society to some degree can normalize certain violence that takes place to certain types of people because of the racial categorization, because of the way how they categorize people's identities.
Mm-hmm.
And then there's also the effect of allostatic load, meaning that if a person is chronically traumatized, they're chronically going through the fight or flight responses. So putting all of that into account, we are not only going to get people that can be traumatized based on by an injury based on their race, but it can also develop into a complex racial trauma as well. Yeah. So we know that trauma is going to exist across the spectrum. There will be things that will be traumatic from that little t perspective, from that big T perspective. And then there are just things that really shake the person to the core. And that's what leads closer to that complex PTSD dissociative experience. So the reason why I focused on finding a clinical approach that helps to treat complex PTSD is because the society is structured in a way where there aren't enough Black therapists, one. Two, that there's a taboo about receiving therapy because of many atrocities that have taken place from the medical system towards Black people. Yeah. If people are wondering, just search for the origins of gynecology and you'll see that there's some terrible things that happened relating to the use of Black people and Black women's bodies to further the goals of people who were seeking esteem and all that stuff. So my clients then, and I get clients from all racial spectrums and backgrounds, but sometimes for the Black clients that I have, no one has done any assessments on dissociation for them.
Yeah.
No one has done any assessment. They haven't done a proper trauma history. And that's the reason why I realized that the symptoms they were presenting with was not just based on the microaggression they would talk about at work. It was not just based on being socialized in an environment that doesn't like people because of their melanin content. It was also the responses they had looked very similar to the textbook definitions of what I'd see for complex PTSD and dissociation. Yeah. So that's why if you're going to target racial trauma, you also need to understand complex PTSD. 100%. And that's the understanding that I hope that I was able to bring to the ISSSTD, but also that's the type of understanding that I think is necessary to advance the ideas of how to treat this specific problem. It's not just about having a fancy framework for understanding racial trauma. There's a lot of fancy frameworks for understanding race and gender and all these things, but we also need to bring along a way of being able to treat the problem. And that's what my focus is. And that's from the computer science part of myself, is that it's not just understanding, it's how do we make it so that it sounds very simple to do and that it also reproduces a result, at like maybe a 95% effectiveness rate.
If you're listening to this podcast thinking, I want to learn more body-based tools to help support trauma recovery, then you might be the perfect candidate for the Yoga for Trauma online training program. This 8-week certification is for wellness providers and enthusiasts who want to learn the theory and best practices for providing yoga and somatic tools to those navigating the impacts of trauma. Students often come into the Yoga for Trauma online training program, or Y4T as it's come to be known, knowing at a deep level that mindful movement can help with trauma recovery, but not knowing precisely how to articulate it or share these tools with others. Y4T breaks it all down and leaves you feeling clear about your choices as you support folks navigating post-traumatic stress. Of course, the experience is good for you too. With 8 modules and 8 yoga classes, you'll get a taste of how it feels to practice yoga in a trauma-responsive manner. Head on over to howwecanheal.com/Y4T to apply and join the program today. Mention the podcast in your application for a special bonus. One more time, nice and slow. The website is howwecanheal.com/Y4 and the letter T. Looking forward to seeing you there. So this is a very simple question with potentially a very complex or simple answer, but how do you see change happening in an individual and outward from there?
Yes. Okay. These are you're keeping me on my toes.
I want to know.
So I'm a I'm a big believer in a memory reconsolidation. Big
Yeah.
believer. I'm a big fan. I'm a fan of Bruce Ecker's work. He helped to popularize memory reconsolidation in our field, and but the way how I use memory reconsolidation is a little differently from his. And it's just so again is that another thing I have to say is that in my past I was also very interested in I'm an artist, so I did hip hop music as well. And I just need to speak about hip hop for a second.
Yes, please do.
Is that hip hop, the way how the artist would do it back in the 90s, okay, in the 2000s and all that, okay. Now people, I don't know what they're doing. I'm too old now. I'm not hip anymore. But anyways, back
I'm with
yeah.
you with the 90s and 2000s, though. We can definitely go there together.
Okay, yes. Let's stay in the golden age. Let's stay in the golden age. So the thing is with hip hop music, the way how it was developed, conceptually speaking, is that you take something old and you make something new with it. So that's why sampling was helpful, or part of it. The DJ would bring a record from like the 60s or 70s and then chop it up with other beats and then make something completely new. So
Lovely
that's
Day.
why,
and for example, the song Lovely Day, one of my favorites.
Yes, there we go. Okay, so I didn't know you're a hip hop head. Okay. So so it's just that even as an artist, like I was an MC, so I'd be rapping on the microphone. And the idea was you're going to take a concept that is seen in a specific way and reproduce it or talk about it in a different type of way. So rather than speaking about it, you're going to rap about it. There will be rhymes in it. There will be metaphors. So the idea of hip hop music is to take something old, make it new, and change it to some degree, in some shape or form. With memory reconsolidation, I feel that what has been very helpful for me in understanding it is that we are not just, I feel that the way how we've been looking at psychotherapy is that we haven't been trying to understand why it works or how it works. So that's why I was really appreciative of Bruce Ecker and other people trying to say, you can use this and this is what will lead to this and this and this. So what happens is a client oftentimes, because of repeated traumatization or even a single event, they make an association in their mind relating to the suffering that has taken place. So what we need to do is we need to make it so that they can re-experience an event without the same pattern taking place. So if they think about the trauma, what happens if an EMDR therapy as well is one of my introductions to it as well, is that what happens if they're able to be in the state of calmness while they think about this problem? Now the brain is orienting towards the problem, but something unpredictable or something not expected is taking place. I'm feeling calm. So I'm feeling calm while I think about the SUDS. So the SUDS decreases a little bit. And then I do something else, move my eyes, tap my hands, and then something changes each time that I'm thinking about it. So now, in a way, we're reconsolidating, we're changing the way how the memory has been structured. Okay.
And SUDS is just subjective units of distress scale for those who are wondering.
Yes. Thank you. I have to remember it too.
How intense is it? 0 to 10?
Yes, you're right. That's the simplest way of explaining it. The intensity of the person's discomfort is how I say it as well. So the thing is that what happens is that I believe that a person's discomfort, if we say that they have a 9 out of 10, they usually have a physical somatic experience, maybe thoughts relating to it. Maybe there's not only just that event, it's also their stress because of their job, their stress because of their relationship, the fear about another panic attack. I think that's what usually makes it so that it gets to a 9 or an 8, and what makes it so it gets to a really stressful level. So when a person is thinking about their discomfort, they're usually thinking about multiple things at the same time. So then what happens if they access it, then put it out of consciousness and then do something completely different? Well, the brain may still be accessing some of this information. And so then what happens, because we're capable of parallel processing, we can walk and chew bubble gum. Humans are complex like that. So what happens if we then do something that's completely awesome? Is it that we are doing something completely awesome and also accessing these stressful events at maybe a subconscious or a lower consciousness level? Then the brain to some degree is also experiencing this disconfirming experience. So it's feeling good while still accessing this material in the background. And when you try to revisit it, it doesn't hurt as much because now something has changed about the way you've chosen to access it. So what happens if you repeat that? What happens if you use something that's completely calm or awesome and it's from the client's perspective, or it's something that's important for them, or something that causes them to experience gratitude or helps them to be oriented to the present? When you follow a sequence of steps, it oftentimes leads to the original memory being a reference point for feeling that gratitude and that calmness.
That full circle.
Yeah. And so that's why I should have mentioned this, but yes, of course, as you mentioned, EMDR therapy was an important part of my understanding for racial trauma recovery, which is how I describe it in the book. That originally I was conceptualizing racial trauma recovery and rhythm and processing as an adjunct to EMDR therapy. But it's more that it's also a philosophy of looking at therapy as well. So it's not just a technique, it's a way of understanding. So this is why it's not just to be associated with just EMDR or as a side for one therapy. I've been teaching this to other people who are also not EMDR therapists, for them to understand that there are common ways that change can happen.
Yes.
So just to underline it is just to say, one of the things that helps change to happen in our sessions is the discomfort, is what we call overturning information. It's called turning the tables on the way how we have experienced this thing.
You just gave me a teaching tool I wish I had 25 years ago, which is to describe healing via hip hop music. Like I wish I had that a long time ago.
Yes.
Take the old song that you like that has a really catchy tune or something.
Yes.
And then put it in the background and have little pieces of it, but then make something entirely new with it that has meaning and metaphor and rhythm and all these.
Yes.
That's a completely new experience. It still weaves in the old thing. And, obviously in the music example, the old song's not bad or traumatic or painful, but that mixing process of taking something that's real, that's in history, that's happened, weaving it into the present, infusing it with thoughts, feelings, reflections from today, making it something awesome. And then when you hear a clip of the old song, it immediately associates you to the new art, new material, and something really, well, I guess it's subjective, but something awesome. Right. And so I love the way you weave that together. And it also makes me think about, you mentioned earlier, this kind of deficit model within, towards Black people within education. I experienced that a lot when I was working with, we used to call it like an at-risk population and all these things. How do we describe this? How do we talk about risk and resilience and prevention? And how do we do it in a way that's really human-centered and isn't so, and doesn't sort of continue this divide? And so I think when you talk about taking this traumatic experience, weaving it into the present, we're not negating it, we're not neglecting it, we're not ignoring it or pretending like it didn't happen or dissociating from it. We're acknowledging it, bringing it into the present, and creating something new based on where we are now. And I think that applies to individual work, and that applies to this larger systems work as well, because we can't change the past. I haven't had anyone on the show that has a time machine yet, right? And if we did, like we all know from the movies, I don't know if this is part of your science fiction book, but we all know if you go mess with the past, you might not even exist anymore. So be careful. We can't go and do that, but we can take everything from where we are now, the painful things, the impacts of trauma, the memories. We can broaden our perspective a little bit, and like, as you mentioned, sort of go further out from the U.S., or the U.S. and Canada. We can go beyond North America. We can go beyond certain timelines and incorporate a broader understanding that I think when we do that, it makes these horrific and traumatic things, like it puts them to scale in a different way.
Yeah.
Right. So I love just referencing art in this, because I do think it's an art. It's, you've brought the coding, and we can bring in theory and we can create frameworks and structures, but there's also this real art, because it's human beings and we're infinitely complex. And I don't even know how many people on the planet. And is it 7 billion or something? I don't know.
I think it's 8. I think it's getting close
now?
to 8.
Oh, yeah. Right.
It's getting close.
So like if someone has the programming for that, that's quite impressive. But we create something through art that we feel too. And you mentioned, this might have been before we started recording, but you mentioned heart, right? Bringing in the heart of things too. And that's something very, very human, very emotion centered, and not so falling into frameworks. So I just really appreciate how you describe that.
Thank you.
And I think it's relatable. Like I'm thinking of a 14-year-old boy I used to work with, that I'm like, oh, if I could have described it to him this way, he would have been on board, because he was an artist, right?
Well, that's the thing, is that if we go a little bit further into it and we think about Milton Erickson, I think he was very skilled at doing this as well, as a master hypnotist or hypnotherapist. And it was really that he was able to just know that people don't come in with problems. And so I had to redefine how I understood psychotherapy because of what I've read, and also because of my clients. Like one thing I want to say about what you explained is that it's kind of like all of it is art. Okay. So even coding is art. Right. I do want to say that for psychotherapy, I think to some degree, therapists needed to be accepted by the medical community. So they had to say these are scientific things and it's based on this and this and this. But the most of, like, when a client is going to go and seek a therapist, they're not going to say, how many books have you read? They just want to know, are you going to be able to help me? Yeah. And I think it's the ability for people to be able to take complex ideas and perspectives from what they learned from their own experience and to put it together. That's hip hop. And especially when we're doing it in a way that is taking into account, like, how do we maybe challenge the expectations? And I think that's hip hop. That's also punk, it's all for, like, I think that when we move towards expertise in any field, the lines start to blur. I think when you become a master teacher, to some degree, you're able to relate to the master artist, and you're able to some degree relate to the master programmer, because I think there's something that unifies all topics if we're willing to look deep enough into it. Yeah. When I said before about the motto of the Black Mountain contingent of defeat the enemy wherever he appears, it's because if I can correct these characters I made up in my mind, the idea is that there is no enemy that exists within oneself. Yeah. Even the fact that a person has a trauma, it brings them to our office. Does that mean that the trauma was a bad thing? We know that it caused them to suffer, but there's something about the suffering that pushed them to say, let me heal all aspects of myself. Right. So I oftentimes remind my clients those types of ideas as well, is that there's no bad parts. There are no bad parts of the individual. It's just there are parts of us that need to heal and parts of us that need to recover. I think the same thing can go on if we speak about politics and society in general. Yeah. Is that we come from this idea where there is an idea of whiteness being superior to other things, or saying, even if we like zoom out a little bit more, there's this idea of there are good people and bad people. Right. But what if we start to move away from binaries and we start to look at the spectrum? Yeah. What if we start to think that maybe the things that are not so good are just things that need to be improved? Maybe the things that we consider as good can also, to some degree, be used to help us to make things better for everyone. I just think that we need to move away from the solid concepts or the things we assume as being truth and move towards remixing our society. And so this is the
remix version. I love that. Of course, I visualize it on a cassette tape, but that is not what it will be.
Yeah. Well, I haven't seen a cassette tape in a long time.
I have one in my closet over here.
That
Oh
is
yeah, I've got a
fantastic. I'm sure
couple old
that's
singles with the little paper around them.
oh yes, I used to make those cassette tapes too. And you'd be
Yeah.
able to record from the radio. You press two buttons down
Yeah.
and oh my goodness. I think some of the
Yeah.
millennials are gonna hear this and be like, what kind of planet these
What
people come
planet is
from?
that?
You know?
One of my
Um,
favorite moments, I'm a big fan of Ted Lasso, and one of my favorite moments is when the character Ted goes, "Hey," throws the keys to the kit man and says, "Go get my CD in my office at home." And the guy's like, "All right, what's a CD?"
yeah, exactly.
Oh my God.
Exactly. You know, I was actually just thinking about that this morning. I was like, it's so strange that we used to have a limit, like such a small limit to the amount of space you could put on a CD. And once you put the information on it, you couldn't change it.
Yeah.
Or if you play the CD too many times in your car, it's scratched now, so you can't listen to it.
Yeah.
And, you know, but this is it, is that to some degree, the people who developed USB drives and the cloud storage, they remixed what was already there.
Yeah.
I think that our
New
field,
possibilities.
psychotherapy, is in need of a remix, that we
I
need to
agree.
look at some of the assumptions that we have about change,
Yes.
some of the assumptions we have about healing, and think, is there a better way of being able to do this? And so when my client is in tears, and it's not only her, I see it frequently enough to tell you about it. And I'm not trying to show off. I'm just trying to say that there's ways that we can help people to heal that exceed their wildest dreams.
Yeah.
And what happens, oftentimes will talk about vicarious traumatization. What happens to a therapist who is able to witness this?
Yeah.
I think you've seen it, Lisa. I think many of your listeners have probably seen it too. What happens when we start to see people who come in and tell us that they're broken initially, and then after they leave and they've also left the label behind? Yeah. What is it that happens to us? And I feel that we have to start with the healing in ourselves. Yeah. And then it helps us to be able to see those types of experiences, to train ourselves to believe that maybe there's something else that we can learn. Maybe there's another thing that we can remix so that we can add that remix potential into other people's lives as well. And that's what I think the gratitude is. Like sometimes I'll teach my clients a technique, and then it's like the next session they'll come in and I'll say, were you able to practice it? They're saying like, yeah, you know, and then they describe what they did. And I'm like, that's not even my technique. I'm like, what is that? But it's because they remixed
it, right? And they're like, you said this. You're like, I don't think I really.
They're like, yeah, you told me to tap on my head and rub my stomach. I'm like, no, that was not this therapy. And then they'll tell me that was super effective.
Right.
So if I told them to do a specific thing and they develop something that works for them, it also helps us to know that maybe part of our role is to train our clients to be better therapists.
Yeah.
And it's a beautiful thing when you can teach a person to reclaim their power. And when we change the hierarchy of saying the therapist is the expert and the client is just the novice or the patient that's just experiencing it, I think something beautiful happens when we tell the client that they're the person of their dreams, and when we show it to them and when they see it for themselves.
And then it's a vicarious experience of healing, right? Mm-hmm. So that rather than this sort of vicarious trauma and burnout factor, it's vicarious growth, healing, learning, all of that. And that feels very generative, right? That doesn't feel, like heavy and burdensome like it can to repeatedly hear narrative of awful things that have happened. That can absolutely be hard. But when we, I love the term awesomeness. Like when we see people step into that in themselves, and we can be a part of that and be a part of that growth, it's enormously rewarding, right?
Yes.
It's a completely different feeling than that challenge and struggle that can come from just hearing the hard stuff.
You got it. Compassion is the gift that keeps on giving. I think that when, even in my session, sometimes, it's just a few days ago, there was a client who brought in an ancestor for their healing and for their recovery. And it's like, it's like, even though it wasn't my resource, me seeing them access something that exceeded their expectations made me feel good.
Yeah.
And it made me think like, this is a person who believed they were broken. But when we're bringing in grandma we're bringing grandma into the session now. We just change your idea as to what this thing actually can be. And if we've done it in the session, what will happen when you go back home? What will happen when you can prove to yourself that you can also change these experiences that have happened from your past? It's true what you said. We may not necessarily have a time machine, but I think we're coming close when we talk about trauma processing. We
Right.
are changing. I feel we are changing the experience of their past. We may
Right.
not be changing the objective past.
Yep.
And I do believe the butterfly effect can be feared, but also it excites me to see that some of my clients, when they heal because of generalization that happens in EMDR therapy and other memory reconsolidation based approaches, it makes me happy when we look at their trauma history. We've healed from one thing and they're like, yo, but this thing doesn't bother me either. Okay, cross that one off too.
Yeah.
Oh, but this thing doesn't bother me also. So I really think we need to change the way how we look at therapy. We need to definitely change the way how our society organizes what's important. I think that politicians need to get their heads on straight and start to really want to resolve important issues. But I also think we need more therapists in general, because we are living in a society that has normalized trauma. So there's a lot of trauma that's out there, but we also specifically need more anti-racist therapists. We need therapists that are going to engage with sexuality, identity, gender, race, and confront the internalized homophobia, racism that exists within them, heal from that suffering, so then they can provide a context that will allow the clients to heal. And when that's completely authentic, or as authentic as it can be.
Yeah. I was going to ask you what you wish everyone knew, but what I hear you saying in that is that it's almost like a wish for the internal process of healing that then reflects externally, right? So, for a politician to have their head on straight, so to speak, I mean, I've seen people push against things like when I was teaching yoga in juvenile halls, there were definitely systemic things that were challenging. And there was a woman who would just scoff anytime I spoke at the team meeting. And it took like 5 years. And at the end of a long stretch, she came in with a yoga mat and actually apologized to me for being disrespectful all that time. And it was, very big full circle moment. But something about me representing yoga there was threatening to her. She actually said that. I apologize. It was threatening. And I was like, I'm very impressed that you have that awareness and are articulating it to me. And I was grateful for that, because so many times, and especially as, a young 22-year-old woman or something, I'd go into these meetings and not feel super empowered. I'm coming in from outside of the system. I'm doing this thing that people think is airy fairy, and they're not really, the science wasn't quite there yet. It just started coming in around that time. And so to have someone be listening for all that time, be open enough to at some point find themselves on a yoga mat, be open enough to come back, or to do enough work to come back and articulate it. That's one of these small examples of the personal healing that then, that would impact all of the youth that she was, supervising and supporting, because then she can understand, well, they're going to yoga and they're having these experiences and they're opening up and they're working through things that are really traumatic. I've done that work. I can support them in doing that work without scoffing, without being dismissive, without telling them to suck it up, right?
Yeah.
Whatever it is. I don't know if she did those things, but that's what we do.
I agree. And also to some degree, I think it should take people less than 5 years. I think that's because there's too much damage. There's too much damage. So this is why we need to humble ourselves a little bit sooner than that. And, it's that the science is catching up to something that's been around longer than some of these scientific methods. So it's like yoga, look at the hieroglyphics in Egypt. Many of them inspired the Dravidian Indians. So we don't even talk about the Kemetic ancient Egyptian origins of yoga. Because again, Black people are not supposed to have they're not supposed to be contributors to this society. So it's just to say that I'm glad that this person changed their mind, but we need a little bit less of a focus on what's in the person's head, but more of a focus on what's in our hearts.
Yeah.
I feel that to some degree we are teaching therapists to focus on ego, maybe because Freud was one of the
Right.
main people. But I think we also need to use, there's like a strategic use of also our hearts. Our hearts are also important in it as well, is being
100%.
humble, being open. And when we do feel as if there's a need to scoff, because you're talking about yoga, trust me, as a Black man who teaches anti-racist psychotherapy, just letting you know, I've encountered all types of madness, but it's just that I think you were solid in your truth.
Yeah.
I'm also believing that I am solid in my truth. And I'm also trying to let people know that it's not just about me. It's about the idea that we need more gratitude, more love in our society. But my goal is to eventually train my replacement, because it's bigger than any one person.
100%.
The only way that we can heal this society is if we are trying to think that we are not finished unless we all get through the healing together. Even the idea, so since you're talking about yoga, I do have to talk about the bodhisattva, is that we need to focus on our healing. We need to think of how others can heal and all of these things as well. And when we do it intentionally to the highest degree, we will start to see that there is a common art that connects all of us together.
Yeah. I love it. And it just all fits right in with the theme of this podcast, like how we can heal. I firmly believe there's a way and we can find it. But it does take more than one person, 100%. It takes really everyone's engagement in some way or another in their own lives, and their, investing in their own gratitude and love. It doesn't have to, like, we can focus that way, right? We don't have to go straight to all the problems and try to reconstruct them and fix them. We can go to our own center, right? And perhaps meditate or just connect with ourselves and recenter and let those other things fall away so they're not centered. They're not central to our experience of life. And that creates a big shift too.
100%. I think that our goal is to some degree to confront the suffering that exists within ourselves. And within that, we can learn wisdom and we can learn bravery. And that courage, I feel, is only as useful as our willingness to then be daring enough to try to bring other people towards knowing that they can also heal from their suffering as well. It is possible for us to use meditation as a spiritual bypass. I've heard many people talk about it in that way, where they're using it to heal from their suffering or to avoid confronting the suffering. But I want to, if there's one thing I can just impart to anyone who's listening, the main thing is just to know that you're beautiful for who you are, that you are beautiful. Your value is your existence. There's nothing you need to do, despite what your car commercials are going to tell you. You're like, despite what capitalism wants to explain to you, you're beautiful because you exist. You're valuable because you exist. But we also need to know that for anti-racism, it's not just reading another book. It's not just attending another webinar. It's about being the change. And so it is a meditation in its own way. Yeah.
And it fits right into parenting, right? What are we passing down? What values? And that's not just through our words, that's through everything we do.
Yes.
So you've already answered, what you would say to someone who's struggling right now. And I think that's a beautiful way to just connect with inherent worth. It's not something we hear enough, right? Watching TV or going online, I don't see it plastered all over the place, but I'd like to see that change. I'm curious, what's next for you? What are you've got a one-year-old and your hands are full. Hopes, thoughts, musings for your future?
Well, I don't know. It's really hard to say because there's so much to do. I think the next thing is I'm going to pick up my son from daycare. I mean,
there you go. Right back to the present.
One day at a time. I think that's one of the main things that has helped me through being able to care for him. But ultimately, it's really that. I think one of my main concerns or one of my main mission objectives is just teaching him to be able to love himself. That's what someone asked me the other day. They're like, "What do you want him to be when he grows up? Do you want him to be a therapist?" And I said, "No, I want him to be happy." Yeah. Like, how can we teach people to know that that's like, how do we make it so that we stop confusing pleasure for happiness? How do we make it so that people will start to believe that that there's this gratitude that already exists within them, that they no longer need to chase it? How do we make it so that we can make it so people believe this inherent worth, that this is something that's tangible, that they're able to feel, that they're able to call forth when necessary? And in between, like teaching my son how to feel happy and helping others to heal from their suffering, I need to continue my own reflection as well. And I really believe that whether it will be the ancestors, whether it will be the creator, the path will reveal itself.
Right there with you. And I ask this of most people, what brings you hope?
What brings me hope is the infinite creativity of the people I speak to.
Mm-hmm.
Spoke earlier about the client breathing in water and exhaling and all these things. It never fails to amaze me that if you give a client the opportunity to access their gifts, they're going to show you.
Yeah.
You know, sometimes it's our focus on the structure of the therapy that can then enclose a person because of the expectations and what we think they should be. Yeah. But I oftentimes tell my clients that, I see my son and I never needed to teach him how to have fun. He knows how to have fun.
Right.
He has a fake, he probably sees me on my cell phone all the time. He has this fake green phone that he like talks into and bites it and stuff like that. It's like, he knows exactly what to do. He's having fun. Yep. And I didn't even have to teach him. Right. So how do we make it so that, that we can bring that, in French, they call it the joie de vivre.
Yes.
The joy of living. How do we make it so that we can teach that to adults or reteach it? How do we make it so that they can see recovery as a way of going back to that, bringing from the past this thing that has always been there all along? Mm-hmm. In the African worldview, they call it Sankofa, is that sometimes you have to go back in order for you to move forward. And I think that that's the whole process of trauma recovery.
Yes.
That we're helping a person to reclaim the gifts that have always been there all along.
And to reclaim the fun and the play and the joy, mm-hmm. right? And, we talk a lot in trauma therapy about building safety, right? Yes. Oh, we want to feel safe. And I agree 100%. But what happens when we feel safe? What do animals do when they feel safe? Well, I know what my dogs do. They're belly up on the floor, chewing on each other, rolling around, yes. having fun. Like there's something that's a very important foundation. And then what? Well, then maybe we can feel joyful and playful and have fun.
100%. That's why I try to get my daily dose of video games.
Yes.
I must. That's why people ask me, what do you do for a living? I say, I read about therapy, I write about therapy, and I play video games.
Nice.
But I also care for my son. I have to make sure that people know
that's in there too.
That is part of it. But it's also important to play Guilty Gear Strive. It's also important to play that and to defeat any enemies who try to test me online.
I love it. So how can people connect with you? How can they keep up with your work and your joy and your video game scores?
Yes. Well, the thing is, for my video game scores, you got to find me. But if you want Archer Therapy, if you check it on LinkedIn, if you check it on YouTube, just at Archer Therapy for Instagram. And go to archertherapy.com and you're going to see my website. On my website, you're going to see all the things that I'm up to, including a mailing list. And if you add yourself onto the mailing list, you're going to see the next time that I come up with another book or another material. Who knows? Maybe another a video game about therapy that involves flying, shooting lasers and stuff. I don't know. You can find me on the internet, David Archer, EMDR Therapy, Montreal. You're going to find me. You put that in. Anti-racist psychotherapy.
I love it. Thank you so much. Thanks for
Thank you.
Your
it's been a joy.
And I've so appreciated our conversation and so appreciate your work and the way you articulate it and the way you share it. And just that full circleness of coming back to connection and joy and gratitude and these, we talked about it with Jennifer Gomez of like dream storming, like let's go beyond the suffering and the pain and like what are we being pulled towards? And yes, I think most people can get on board with like, that sounds nice. I would like awesomeness and play and fun and joy. So I think it's it's a better sell for trauma therapy for sure. We don't just need to restructure, we need to rebrand.
Yeah, we do. But
it really
especially,
is a beautiful thing. And it really is almost a process of soul retrieval for some people.
But it ain't easy, but that's why we also need courage.
Yeah.
And we need the ability to love each moment of it, whether the not so good and the good and everything in between.
So thank you, David. I can't wait to share this episode. It's been amazing just chatting with you. And I'm grateful for your time, especially knowing that you're caring for another human being. And that time is very valuable, one way or the other, whether you're doing that or not. Thanks so much for listening. My hope is that you walk away from these episodes feeling supported and like you have a place to come to find the hope and inspiration you need to take your next small step forward. For more information and resources, please visit howwecanheal.com. There, you'll find tons of helpful resources and the show notes for each show. Thanks for your messages, feedback, and ideas about the podcast. I love hearing from you, and I so appreciate your support. There are lots of ways you can support the show, and I'm grateful for every little bit of love you share. If you love the show, please leave us a review on Apple, Spotify, Audible, or wherever you get your podcasts. You can always visit howwecanheal.com/podcast to share your thoughts and ideas as well. Before we wrap, I want to be clear that this podcast isn't offering any prescriptions. It's not advice or any kind of diagnosis. Your decisions are in your hands, and we encourage you to consult with any healthcare professionals you may need to support you through your unique path of healing. In addition, everyone's opinion on this show is their own, and opinions can change, right? Guests share their thoughts, not that of the host or sponsors. I'd also like to send just huge thanks to our guest today, to Kyle Arizbal of Prolific Sound Solutions, and to everyone who helps support this podcast directly and indirectly. Alex, thanks for taking care of the babe and the fur babies while I record. Lastly, I'd like to give a shout out to my big brother, Matt, who passed away in 2002. He wrote this music, and it makes my heart so happy to share it with you here.